Sciatica affects thousands of people all over the world. So, doctor, can you tell me some of the common causes of sciatica?
Sciatica is actually the condition in which low back pain, which is radiating to the limbs, lower limbs. That means the pain which is starting from the back and it is extending to the thighs. Again, it is extending to the calf muscles and may extend to the fingers, foot fingers, up to that. That is actually called a sciatica. This is actually usually caused due to continuous sitting, like jobs. That type of jobs, for example, IT professionals, they may be sitting for a very long hours, like 8 hours, without any activity. That actually gradually leads to Vadavrti in that particular area, leads to degenerative process that finally end up in a disc disease or a diffuse disc bulge or something else. The damaged disc, which gradually give compression to the nerve, which will trigger a sudden sharp shooting type of pain. That is actually a sciatica. So when we talk about a cause, either it can be a sedentary activity or a long sitting like sedentary activity, or it can be some sort of accident like sudden torsional stress, which is exerted over the lumbar region or somewhere else in the spinal cord, spinal system. So there may be some rupture in the protective structure of the spinal structure, may lead to this sort of nerve injury or this idle sitting for a long hours. That type of job. These two are the common dimensions of the cause.
Doctor, what is the Siddha aspect to this?
Actually, sciatica is the lower body problem. Actually, sciatic nerve is the longest nerve in the body also. So, because of the compression of the lumbar spine, most probably more than 80% of the problem is persisting because of the compression. So, Siddha, there is two type as doctor told. There is because of the degenerative processes that is already happened in the disc and the spine structures. That causes a compression of the sciatic nerve. Second thing is because of the fresh injuries, that a heavy hit injury to the lower back area, that also causes a consistent compression to the area. So our first concern is to reduce the pain. Second concern is to decompress that compression already happened. And third, we will analyze what is the already happened damage. If it is in the structures of the spine, maybe because of the structures of the disc, or maybe in the nerve roots also. So we will consider it is as a Vadaroga. In Siddha, it is actually known as Tandakavada. It is an extension of Tandakavada. Tandakavada means purely it is a lumbar spondylosis, but it may affect like a sciatica also. So there is an aggravation of Vada, because in our concept, if there is a pain, there is a Vada aggravation. So we have to reduce the humoral activity of Vada with some medication. So first line treatment, we will go for Shamana. That will reduce the pain and all. For that concern, we will use Ayurveda Chandura, Amukura Churna. If there is any swellings happened inside that area, we will definitely use Jalamanjari to reduce the swellings. If it is a degenerative process has happened, we will add Armaga Chanduram. Like that, so much of panel of medications we have to administer to reduce the problem. Second thing is, if there is some sciatica, it will associated with tingling sensation and numbness also, along with the radiating pains. At that condition, we will use Nirgundi type medications like Nirgundia Diarandam. It is a prepared proprietary medicine from Santhigiri. And there is also Armuga Sundaram is already told. Next is Ayurveda Chanduram. That is also a combination. And Merugugal, that's Irasagandhi Merugu, Nandi Merugu, like higher medicines also we will administer in this condition. And the second thing is the oil application. So we have to reduce the pain. For that, any type of radiating pains, Vadakesari Leguvishamushti combination. Leguvishamushti is a very powerful neuro medicine to reduce the pain, any type of pain that is related to nerve. So Vadakesari Leguvishamushti combination, heat and apply to the external application, that will increase the flow of the nerve functions and reduce the pain also. So like that we will manage according to the conditions.
In addition to this, in Ayurvedic protocols, almost same methodologies are used, along with if it is a very severe in-depth condition with admitted procedures like a course of Yogavasti. That means a combination of Kashayavasti and Snehavasti can be adopted with the specific medications as per the condition demands. Along with the preparatory Panchakarma procedures like Sneha Sveda can be applied with the Potali Sveda or Abhyanga Sveda. That type of procedures can be applied, because due to the underlying pathology, there will be nerve root damage, partial damage, or there may be inflammation to the damaged disc. Everything will be there. This has to be addressed properly. Once it is properly addressed, gradually pain will reduce. Then we will go for the next measures like preventive action. Preventive action in the sense, usually there will be low back weakness will be there. So that has to be corrected with a specific defined exercise. For example, Surya Namaskaram, performing Surya Namaskaram under the proper medical guidance with the specific stress to that particular area will give more strength to the muscles. Ultimately, the muscles will give more support to the bones. So automatically the nerves will be protected, because followed by the treatment, nerves will be in somewhat repairing phase. In that phase, we have to give proper rest, proper exercise. So gradually he will be in a situation in which he can cope up with the other things, even with the pain, and gradually the pain will be relieved.
It should be a balance.
It should be balanced.
Sciatica is a condition that requires early identification and quick intervention.